बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलामुअलैकुम। डॉक्टर मोहम्मद शाहिद के यूट्यूब चैनल पर खुश आमदीद। कुछ डॉक्टर्स ऐसे होते हैं जिनके साथ काम करके आपको फ़ख्र महसूस होता है। आज से 22 साल पुरानी बात की जाए तो डॉक्टर सायरा निज़ामी ख्वाजा के साथ मैंने एज अ जूनियर रेजिडेंट काम किया था। डॉक्टर सायरा उस वक्त सीनियर रेजिडेंट थी, चीफ रेजिडेंट आगा खान यूनिवर्सिटी हॉस्पिटल कराची में, और आप FCPS पार्ट 2 की ट्रेनिंग कर रही थी। लेकिन जितनी मेहनत के साथ आप काम करती थी उससे हमें भी होता था कि डॉक्टर सायरा ये ना पूछ लें, डॉक्टर सायरा मरीज़ का ना पूछ लें। तो डॉक्टर सायरा से आज हम बात करेंगे। आप जब कॉलेज ऑफ फिजिशियन एंड सर्जन्स ऑफ पाकिस्तान कराची के कैंपस में मेन जाएं तो मेन बिल्डिंग के अंदर लेफ़्ट साइड पे डॉक्टर सायरा निज़ामी ख्वाजा का नाम लिखा हुआ है, क्योंकि आपने FCPS जनरल सर्जरी में गोल्ड मेडल हासिल किया और MBBS आपने आगा खान यूनिवर्सिटी से किया। उसके बाद FCPS की ट्रेनिंग आगा खान यूनिवर्सिटी हॉस्पिटल कराची से की। उसके बाद आपने ब्रेस्ट सर्जिकल ट्रेनिंग FRCS UK से किया और फेलो ऑफ द यूरोपियन बोर्ड्स ऑफ ब्रेस्ट सर्जरी FEBS किया। आजकल आप कंसल्टेंट ऑन्कोप्लास्टिक ब्रेस्ट सर्जन है प्रिंस फिलिप हॉस्पिटल UK में। हमारी बहुत खुशकिस्मती है कि डॉक्टर सायरा ने अपना टाइम निकाला और आपके लिए UK की ट्रेनिंग रिगार्डिंग ब्रेस्ट सर्जरी के बारे में ये प्रोग्राम तरतीब किया। Over to Dr. Saira.
Assalamu alaikum. Dr. Shahid has asked me to talk about breast surgical training in the United Kingdom. So before I go on, I will give you a brief background of how I got to the point of being an oncoplastic breast surgeon here in the UK. I know Dr. Shahid has already gone through some of the background related to myself. So I initially did my medical school training internship and general surgical training in the Aga Khan University Hospital, Karachi, Pakistan. I graduated from there getting an FCPS Part 2 degree, and then I came to the UK mainly for family reasons and also to subspecialize in breast surgery itself. So when I came here, I initially had taken the MRCS exam, which allowed me to get specialist registration over here. Went on into a non-training general surgical position in which I did 5 years of general surgery with breast surgery, attained all of my competencies, and then was able to take the intercollegiate FRCS exam. I passed that and then did the European Boards of Breast Surgery, followed them by a Caesar pathway, which I'll explain in detail, to attain specialist registration over here. And this then allowed me to become a substantive consultant. So up till now, in terms of breast surgery and the training program related to it, it is mainly incorporated, or in fact really primarily incorporated into the general surgical program. Breast surgery at this point in time has not been considered to be a separate specialty. Therefore, people who are interested in going down the route of becoming a breast surgeon, is the way it is done is in the following manners, in the following rather steps. So firstly, after graduating from medical school, be it over here or abroad, if you're abroad, then obviously you have to attain some form of an exam to get registration to work over here, and that would be registration in the GMC. The way that is done is either by taking the PLAP exam or presently by taking the MRCS exam up till Part 3 and then being able to apply. After that, one can then go for a foundation program position. So a foundation program is basically year 1 and year 2, which is equivalent to a house job in Pakistan. This incorporates 3 rotations, which are 4 months each. And those rotations can be anything over a 2-year period. So essentially, every year there's going to be 3 rotations that a trainee will be going through. So essentially, 6 rotations in total by the time they finish their foundation year program itself. Once the FY1 and FY2 is what we call it is completed, then the candidate who's interested in surgery or be it medicine or any other specialty goes then into core training. Now, for core training specifically for general surgery, it's a 2-year program in which one would be expected to complete their MRCS exam. And the rotations again are 3 rotations over 4 months respectively for each of the years, again essentially making it 6 rotations. These rotations can be anything and are completely dependent on what you are interested in. So if you're interested in urology, you'll obviously be doing a core trainee job in which there will be at least 1 urological rotation, if not 2. With breast surgery, really, in terms of the core training, there isn't specifically a breast surgical post for 4 months, but what we have is that we've got core trainees who are interested in plastic surgery, and they then tend to come and rotate and do a bit of breast surgery during the plastic surgical rotation. So they can come in and attend theaters with us, they can come and attend clinics with us. After the 2 years core trainee, then the individual does a surgical training, basically a program which is 6 years in total, and they need to actually apply to this through all of the separate deaneries throughout the UK. So the 6 years are essentially from ST3 to ST8, and anyone involved or interested in breast surgery, basically they have to start off with general surgery, and in the last 2 years, and if they really want to specifically dedicate their training to breast surgery, they can spend the last 2 years doing that particular speciality. But they will continue to do general surgical on-calls because this is a requirement presently of the intercollegiate FRCS exam. After they've completed their ST training or in their last year, they can then start applying and going through the intercollegiate FRCS exam, which essentially includes a MCQ part, which is the part 1, and that's pretty much all online. That covers all of the specialities. So that would be general surgery, vascular surgery, not usually cardiothoracic surgery, upper GI, lower GI, and breast. After the FRCS exam part 1 is completed, then the trainee or the person interested in the Caesar pathway will then do the part 2 exam, which is 2 days of vivas. So one day is going to be is pretty much around clinical examinations, in which essentially you're looking at 6 patients to examine from a general surgical point of view. And if you're interested in breast surgery, then there'll be 6 patients in which you will examine from the breast point of view. So that is how they divide it. And likewise, if you're interested in upper GI, then the second clinical examination part will be for upper GI or lower GI patients. The second day is includes vivas, and that is essentially one viva in which there are 2 articles that are discussed with 2 different examiners. One will be of general surgery. That will be an article that you would read through and then evaluate and go through it with 2 examiners. And then the other one would be, if you're interested in breast, would be a breast viva, and based on a breast article that they've given you to read. The next step then will be a viva related to emergency surgery, and then finally a viva related to breast surgery. So when you pass the FRCS, then generally it's going to be an FRCS with general surgery with an interest specifically in your speciality, be breast, upper GI, or lower GI. So this is the pathway that we presently have. And essentially, if you are a non-trainee, you would be expected to go through the exact same thing. But in this particular situation, you would be doing all of your competencies on your own accord. So you would be completing all your workup-based assessments with your primary consultant, signing yourself off, getting referees then to be able to take the exam and moving forward with this. The situation, though, that we're looking at now, specifically with the Association of Breast Surgeons, is to possibly implement breast surgery as a separate speciality. And this is something that would be very similar to vascular surgical training, where the vascular trainees now, after core training of 2 years, they go into a direct 6-year program only related to vascular surgery with the on-calls and the elective work related to speciality. With the breast surgery, they're beginning to look into this, in which the Association of Breast Surgeons with the Royal College to possibly implement a 4-year breast surgical program, in which after core training of 2 years of general surgery and whatever respective specialties have been included, then the candidate who is specifically interested in breast and oncoplasty will do 4 years, in which they will be doing mainly breast, in fact, just really only breast surgical elective work. With or without on-calls has yet to be discussed later on, but it probably will be looking at, in the long run, more than likely not having on-calls related to general surgery, and then eventually with an exit exam specifically for breast surgery. But this is probably a pathway that's going to take many years to come about, and is not really a situation that we're looking at in hand at this point in time. For the Caesar pathway, just for all of you to be aware, if you're a non-trainee, you've trained extensively in Pakistan, then the Caesar pathway is a very good route. You can come over here, go into a non-training position, and then do 5 years of your subspecialty in detail. The exit exam in this case now is the European Boards of Breast Surgery, which in fact the GMC has accepted as an exit exam for anyone who's applying on the Caesar pathway, specifically for breast surgery as a specialty. So this is obviously very positive for anyone who may come over here and then decide not to continue on with general surgery, but to really gain all of their competencies related to breast surgery itself. So those are the two pathways are available in terms of the UK to becoming a consultant. There's a training route, there's a non-training route. I would essentially state that if you're very well experienced, there is no reason to start from scratch and start from an FY1 or FY2 or core trainee, but in fact, really to go through the Caesar pathway. The reason why breast surgery training has become a topic of discussion in a very heated manner to make it a separate specialty is really because of the fact that there is no doubt that breast cancer workload has increased significantly. And essentially, anyone who becomes a breast surgeon ends up getting a job only in that specialty. And the only work that they end up doing in the long run, like myself, is elective breast surgical work. Because you're working in a dedicated breast unit with a radiologist, oncologist, and your workload primarily ends up being at least 4 to 5 breast cancer surgical procedures a week. The oncoplastic work includes reconstructions, which are mainly with implant-based reconstructions and LD flaps. DF flaps, which are the free flaps, are primarily done by, and in fact really only done by the plastic surgeons. The breast surgeon is only involved in doing the skin sparing or the resectional part. So this is a program that you can look ahead at. In terms of Pakistan, I'm really not aware of the situation about the training there as yet. I do know that there are 6 institutions in Pakistan which have been accredited as sites where one can do 2 years of breast surgical training and do the FCPS Part 2 exam in breast surgery. This particular exam, though, is not recognized in the UK as yet, and it would be imperative to really do the European Boards of Breast Surgery to retain any possibility of registration over here as a consultant in the long run. So it's a very brief discussion I've gone through, and it's just over 10 minutes. I could go through it in a lot more detail. I'm more than happy to take any queries through Dr. Shahid for any of you who may be interested in the breast surgical pathway and anyone who would like to consider training over in the UK related to this speciality. I hope I've been of any help, and like I said, I'm more than happy to be in contact with any of you when and if needed. Thank you very much.
डॉक्टर सायरा, बहुत बहुत शुक्रिया। आपने तफसील से बताया कि किस तरह यूके में ब्रेस्ट सर्जरी की ट्रेनिंग की जा सकती है और एज अ कंसल्टेंट ब्रेस्ट सर्जन कैसे काम किया जा सकता है। पाकिस्तान में भी ट्रेनिंग के बारे में आपने बताया। अगर आपने मेरा यूट्यूब चैनल सब्सक्राइब नहीं किया तो सब्सक्राइब करें, क्योंकि अभी बहुत सी स्पेशलिटीज़ के बारे में हम बात करेंगे। नेक्स्ट है प्लास्टिक सर्जरी, पीडियाट्रिक ICU, न्यूरोलॉजी और बहुत सी फील्ड्स। तब तक के लिए अल्लाह हाफिज़।